Xenotransplantation is perhaps the most exciting frontier in kidney transplant that we've seen. And although it's not new, it's been around for a long time. This is the first time we've seen substantial improvements in patient outcomes and substantial longevity in these xenotransplanted kidneys. And as a result, this year, the FDA approved two companies to conduct clinical trials in kidney transplantation. And these trials will be either an expanded access program or the compassionate use program that will allow investigational products to be used outside of clinical trials when patients have a potentially life-threatening condition. So for some of these patients who have uh, kidney failure, who cannot get a human kidney for any reason, this would be a great opportunity for them. The other trial is really looking at the UKidney trial is looking at transplanting 6 patients with end-stage kidney disease and potentially expand to another 50-patient pool. So we're really excited about both these in terms of providing access to patients, not just as a bridge, but perhaps for some as lifelong therapy. I still think xenotransplantation is a bridge. Whether or not these kidneys will last the 5, 10, 15, 20 years that we are seeing human kidneys last now is unknown. The second thing is what the risks are of the genetically modified organs and whether or not changes in the new immunosuppression that will be needed can have adverse effects is unknown. But promisingly, the short-term studies have suggested that kidney function itself seems to be well. Whether or not that plays out into the longer term is something that only time will tell. But I'm really hopeful. And again, a lot of patients are unable to get kidneys from humans. They can't wait that long, and this would be a fantastic opportunity to get them off dialysis, which significantly impairs quality of life and their ability to, do things that they would want. And this may be the option for patients who are also have other comorbidities like heart failure or other illnesses that would prevent them from effectively being able to receive a human organ given our shortages. Well, I'm really hoping that xenotransplantation works. And when I say works, I mean I hope it works for 6, 12, 24 months at least, because we see this in heart transplants where people have LVADs put in and they're able to continue their life outside as a bridge to transplantation. This could be considered a bridge, but the ethics of it and the longer term complications of it and the multidisciplinary groups that need to come in to regulate it, I think will still need to be sorted out.